Yeah, welcome back. Warm wishes to everybody. In the previous ECG, we just told about a normal ECG where a regular rhythm is there. I have put on a table and a chart board P, Q, R, S. That are the normal ways which we see. Today, we will see an abnormal ECG. This type of abnormal ECG is still not causing any hemodynamic disturbance for this patient. And this is the commonest rhythm disturbance we'll come across in a valve patients. Mitral valve disease, either stenosis or regurgitation, this is the commonest rhythm we'll come across. And this is the rhythm which is seen in senile people, old people, without any disease in the coronary arteries. What is that rhythm? That rhythm is called atrial fibrillation. What is it called? Atrial fibrillation. When we are ending the last session, we told the time interval between the R and R is equal and constant. That is the normal sinus rhythm. Here you watch. This is R wave and this is the second R wave. The time gap between these two R waves is different from these two R waves. So this is an irregular beat. What you see over here is a T wave only. There is absence of P wave. Preceding the QRS wave, there is no P wave. So the absence of P wave and irregular RR interval, these are two characteristics of atrial fibrillation. What is the third component? This is another patient. He is a post-op monitoring patient. Monitor. This patient had undergone mitral valve replacement and his rhythm was atrial fibrillation even before surgery. Even now also it is atrial fibrillation. Because that body hemodynamics are used for atrial fibrillation, it doesn't have any abnormality in the blood pressure. There are no inotrope support. See the blood pressure here, 124/88 and the normal mean arterial pressure also. And you see, this is the heart rate and this is the pulse rate. Now we'll concentrate on the pulse rate now. Are they two correlating? They are not correlating, number one. Number two, if you see this pulse, it is changing. Sometimes it is 80, sometimes 86, again 87, 89, 91, 92. It is changing every time. There is another characteristic feature of an atrial fibrillation. This patient is a post-op patient now with an atrial fibrillation but a normal pressures and is on room air. And there is no tachypnea also. This wave is respiratory rate wave. There is no tachypnea. And this wave is CVP line. And what we are seeing is the pulse oximeter. This is the pulse and the oxygen saturation. If you go back in the previous video sessions, in the classes we told about the monitor. We can monitor 7 parameters in this. Here we are able to see 1, 2, 3, 4, 5 and 6. So today what we are understood is atrial fibrillation. This patient is having atrial fibrillation but a stable rhythm and a stable blood pressure.